Dirofilariosis are parasitic diseases caused by nematodes of the genus Dirofilaria, such as Spirurida or Onchocercidae, which are transmitted by various mosquito species. The most significant species that cause dirofilariosis in dogs are Dirofilaria immitis, that causes canine heartworm disease, and Dirofilaria repens, subcutaneous dirofilariosis, usually asymptomatic, which may also have other mammal hosts, such as cats and humans. In humans, D. immitis may lead to the formation of pulmonary nodules, and D. repens may localize in different tissues and organs. For instance, subcutaneous tissue, the eyes, free worms under the conjunctiva, pulmonary nodules, and testicles, and cause disease. Pulmonary dirofilariosis may be confused with pulmonary neoplasms, benign, carcinoma, metastasis, tuberculosis, or mycotic infections. Case 1. Stray dog, unneutered male, 4 years old. Clinical signs: cough, exercise intolerance, abnormal lung sound, diarrhea. Stray dog, unsterilized female, 2 years old. Clinical signs: neurological signs of distemper disease. Case 3. Stray dog, unneutered male, 10 years old. Clinical signs: cough, dyspnea after low-intensity effort, abnormal lung sound. Diagnosis protocol of Dirofilaria infection: direct blood smear, modified knot test, serological tests, diagnostic aids such as echocardiography and radiography, serum biochemistry tests. Direct blood smear. Direct blood smear is done by placing a drop of blood with EDTA or heparin on a slide and covering it with a lamella, then examined under a microscope. In positive smears, live microfilaria can be seen. Modified knot test protocol: 1 milliliter of blood is taken on the EDTA, 9 milliliters of buffered formalin 2% are added, and the solution obtained is centrifuged for 5 minutes at 1500 rotations per minute. The supernatant is decanted from the centrifuge tube and the sediment is mixed with equal parts of 1/1000th methylene blue dye. The colored sediment is spread on a slide, being covered with a lamella and examined under a microscope. Modified knot test. Morphological characteristics of the microfilaria Dirofilaria spp in dogs. Modified knot test results. Case 1. Presence of microfilaria D. immitis and D. repens, co-infection. Case 2. Presence of D. immitis microfilaria, Case 3. Presence of D. emittis microfilaria. Serological tests. ELISA. The PET-check canine heartworm antigen test is an enzyme immunoassay for the detection of dirofilaria emittis antigen in canine or feline serum or plasma. A microtitration format has been devised in which antibodies to D. emittis antigen are coated on test wells. Upon incubation of the sample in the coated test well, antigen in the sample forms complexes with the coated antibodies. Following removal of the sample, an enzyme-conjugated antibody is added and binds to the antigen captured in the well. In the final step of the assay, unbound conjugate is washed away and enzyme substrate or chromogen is added. Subsequent color development indicates the presence of heartworm antigen in the sample. Case 1. Positive antigen D. emittis. Optical density 867. Case 2. Positive antigen D. emittis. Optical density 1134. Case 3. Positive antigen D. emittis. Optical density 1321. Echocardiography. Case 1. Cardiac inspection. Tachypnea. Normal mucous membranes with pink and moist. Sound from pulmonary area without specific cardiac murmur sound of heartworm. Heart rhythm between 90 and 100 BPM. Powerful, symmetrical and synchronous pulse. Systolic blood pressure 140. Diastole 78. Echocardiography may provide insights into the clinical status of patients. The presence and severity of pulmonary hypertension can be precisely determined by Doppler echocardiography. Moreover, echocardiography may allow to visualize adult heartworms as two parallel hyperechoic lines in the main pulmonary artery, left and right interlobar branches, or right heart atrium and ventricle. Arrhythmic respiratory sinus rhythm. P wave is normal as amplitude and duration. ST segment is normal. No atrial or ventricular extrasystoles were observed. In the pulmonary artery branches, no specific echocardiographic aspects of heartworm were observed. No tricuspid regurgitation or pulmonary artery was observed. No severe infection. Two-dimensional echocardiogram in the transaortic section. The image highlights a normal ratio between the diameter of the left atrium and aorta. Two-dimensional echocardiogram in modified transaortic section highlights pulmonary artery. The PA has normal diastolic diameter. In the right pulmonary artery branch, there are no dirofilaria emittis adults. Echocardiography. Case 2. Cardiac inspection. Fatigue at effort. Dyspnea after low-intensity effort. Pink intense of mucous membranes. Body condition score is good. Intense pulmonary sounds. Undetectable heart sounds. strong, symmetrical, and synchronous pulse. Heart rhythm between 95 and 110 BPM. Echocardiography may provide insights into the clinical status of patients. The presence and severity of pulmonary hypertension can be precisely determined by Doppler echocardiography. Moreover, echocardiography may allow to visualize adult heartworms as two parallel hyperechoic lines in the main pulmonary artery, left and right interlobar branches, or right heart atrium and ventricle. Bidimensional echocardiograms with transaortic modification in longitudinal section of the pulmonary trunk and its right branch. The adult heartworm can be observed as an equal sign highly echogenic in the RPA. The diameter of the PT is equal to the diameter of the aorta. Low tricuspid regurgitation observed by Doppler echocardiography in the left apical section of the four chambers. Pulmonary diastolic regurgitation in two-dimensional echocardiogram in the modified transaortic section. Two-dimensional and M-mode echocardiography with longitudinal section. View of the four chambers. There is a moderate dilation of the right ventricular diameter compared with left ventricular diameter. No left ventricular remodeling is observed. Two-dimensional and M-mode echocardiography with transpapillary section, assessment of right ventricular cavity and right ventricular wall in diastolic and systolic function. The right ventricular and diastolic diameter is approximately equal to 1/2 of left ventricular and diastolic diameter. Echocardiography, Case 3. Cardiac inspection. Dyspnea at effort, frequent coughs, lower body condition score. The mucous membranes are pale, cyanotic. Cranial diastolic sound of moderate intensity in the lung. Increased pulmonary rates. Strong, synchronous, and symmetrical pulse. ECG, normal cardiac sinus rhythm without significant abnormality. Normotensive. Echocardiography may provide insights into the clinical status of patients. The presence and severity of pulmonary hypertension can be precisely determined by Doppler echocardiography. Moreover, echocardiography may allow to visualize adult heartworms as two parallel hyperechoic lines in the main pulmonary artery, left and right interlobar branches, or right heart atrium and ventricle. Two-dimensional echocardiogram in the modified transaortic section with the longitudinal section of the pulmonary trunk and its right branch. The equal sign of the heartworm adults can be observed in the RPA. The diameter of the pulmonary trunk is greatly dilated compared to the diameter of the aorta. Two-dimensional echocardiogram in the transpapillary section. Enlarged right ventricle compared with the left ventricle. Abnormal ultrasound with evidence of caudal vena cava and its branches. This represents an indirect sign of pulmonary hypertension. Radiography. Radiography may provide insights into the clinical status of individual patients. Typically, radiographic findings of heartworm vascular disease include enlarged, tortuous, and often truncated peripheral intralobar and interlobar branches of the pulmonary arteries, particularly in the diaphragmatic lobes. Pulmonary bronchial model with radiopaque walls. See the red arrow. Moderate ectasia of pulmonary vessels. See the blue arrow. Red arrow, peribronchial infiltrate. Blue arrow, ectasia of vessels. White arrow, enlarged cardiac silhouette in the pulmonary trunk. Interstitial pulmonary modal in diaphragmatic lobes. See the long blue arrow. Larger D-shaped right heart. See the short blue arrow. Radio-opaque pulmonary consolidations with circular aspect. See the short red arrow. Increased area of the cardiac silhouette in the pulmonary trunk. See the long red arrow. Biochemistry blood test. Thromboembolism caused by natural or drug-induced death of adult worms may lead to life-threatening dyspnea and hemoptysis. Anemia, thrombocytopenia, proteinuria with renal insufficiency, and azotemia may be present in some cases.